The following segment is sponsored by Endogenix. Are you one of the more than 34 million Americans living with type 2 diabetes? A first-of-its-kind non-surgical procedure is now in clinical trials, offering new hope to slow or potentially stop the progression of the disease. Dr. Barham Abdiaye, he's here to share more about this. Welcome to the show. Anxious to chat with you.
Thank you for having me. Thanks, David.
You got it. Now let's start with square one, just the basics. What is type 2 diabetes and why is it such a serious health issue for so many people?
As you alluded, David, it's a common problem affecting 34 million Americans with really serious consequences to health. At its core, type 2 diabetes is a problem with what we call insulin resistance. Insulin is a hormone that your pancreas produces to help manage sugar. In type 2 diabetes, the body stops responding well to insulin and you develop this insulin resistance. That resistance with time causes chronic elevation in the blood sugar levels, and these elevation causes a multitude of negative consequences to health, affecting really every organ system, from the brains to the eyes to the heart to even the peripheral nerves in your legs. Therefore, understanding root causes of the disease and targeting it with treatment is an important paradigm, and that's the premise of why we're developing this technology and investigating it.
It's a big problem for so many people, so we're looking for big solutions. And you've got a new procedure. Can you tell us how this procedure works and what makes it different from other current treatment options that are out there right now?
Yeah, right now we're managing diabetes by mostly, or type 2 diabetes by mostly focusing on its symptoms. And there's a multitude of drugs, and these medications are lowering the blood glucose or the blood sugar as management of the symptoms of that disease. Few of these treatments are targeting root causes of this insulin resistance. Now we know that the GI tract plays an important role in regulating metabolism, especially the first part of the intestine, this area called the duodenum. It's really a metabolic center, and that metabolic center gets diseased with states of type 2 diabetes, an entity that we refer to as diabetic duodenopathy. So the hope here is we target this diabetic duodenopathy with this endoscopic procedure. It's not surgery. This is an endoscopy, just like a colonoscopy, where you go through the patient's mouth. We get to that duodenum, which is the first part of the intestine, and we administer these pulse electrical fields that reestablish healthy cells within that duodenum, and with the hope that we're targeting insulin resistance and modifying the disease to delay its progression. So it's really a novel target for the disease that differs than many of the medication available currently that manage the blood sugar themselves.
Non-surgical procedure, this is fascinating. How can people with type 2 diabetes learn if they're eligible and also get more information about this procedure?
Absolutely. So if you're an adult patient struggling with type 2 diabetes on medications, but the blood sugar controls have not been optimal, it's a very important opportunity to seriously consider participating in this exciting trial. To learn more, I would refer you to the study website, where there's plenty of information about the procedure, your eligibility, and you could get referred for this for evaluation to participate in the study. The study website is resetstudy.com. Reset is RECET study.com.
Absolutely fascinating and promising for so many people. Thank you, Dr. Abdiaye. Really appreciate your time and good luck.
Thank you for having me. It's a pleasure to be with you.
Thanks.